think of a purple elephant. Can you do that?
Mm-hmm.
And now tell me the size of your purple elephant.
Massive.
Massive. Like how big in terms of feet?
The Hulk from the Avengers, but
Okay.
purple.
Massive indeed. Okay. And what do you see surrounding your purple elephant?
A forest?
A forest. Okay.
Yeah. A lake?
Okay. What is the expression on its face?
Pretty happy.
So if you notice, Yuri, you have in your mind right now a thought of a purple elephant, right? It's a complex and vivid thought. But in reality, Yuri, is there a purple elephant as you have it in your mind now?
Not that I know.
Okay. Okay, so this mental exercise, it may seem so silly, so funny. It's reminding us something that we often forget. Okay, that the fact that something is there in the mind doesn't automatically mean it's true. Hence, if it's not true, then it can be inaccurate, false, or worse, it could be a lie. Welcome to TMC Talks, the Medical City podcast where we explore topics related to wellness and health.
Hi, everyone. I'm Yuri Marshall, the CEO of Mind You, and today's host, and a suicide survivor. For today's episode, it's going to be dedicated towards a critical and often misunderstood aspect of neurological health called depression. Depression in the Philippines, according to the DOH, affects more than 17 million people. Yet, it remains shrouded in stigma and misconceptions. Our goal today is to shed light on what depression truly is, its symptoms, causes, and the various treatment options available. We'll also share personal stories and provide resources for those seeking help. So joining us to navigate this important conversation is Dr. Daphne Ong, a renowned psychiatrist at the Medical City. Dr. Daphne,
Yes,
can you
Yuri.
tell us a little bit about depression?
Okay. Well, depression basically is as you know, it's a medical illness. It's a brain disorder that affects how people think, feel, and behave. So it's characterized by depressed mood, low levels of interest. And what's unfortunate is that it can really impair one's functionality, and even it can impair and cause disabilities, and of course, the most dreaded complication, which is suicide. And we know that the numbers now are very alarming, right? Like around 700,000 and above are committing suicide all over the world now. And what I find more alarming is that in every completed suicide, you have 20 others trying to attempt suicide. Right?
Yeah, so I'm a suicide survivor, and I think we can get into that later on. I think depression is a huge factor for a lot of people. I think for people listening, what would you say are the most common symptoms
Okay.
for depression?
Yeah. Well, the most common symptoms, we have depressed mood. We have difficulties in sleeping, whether they're sleeping a lot or sleeping very little. You have reduced interest, like they don't get to enjoy the things that they used to enjoy. There's also that strong feeling of guilt. They feel very low in energy, find it very difficult to concentrate, hence work or studying gets affected. We also have problems with psychomotor retardation or agitation, meaning they either get too slow or too restless. And of course, they start having thoughts of wanting to end their life and unfortunately, getting into suicidal behaviors.
So that's interesting. That's a lot.
Oh, yeah.
What I'm hearing is it could be anything, right? In terms of symptoms. What would you say are the major causes
Okay.
of depression or factors that can cause?
That can cause depression. What causes depression, we can say, is a complex interplay of multiple factors. We have biological factors, meaning the genes you're born with, family history, the chemicals in your brain, the imbalance there. We also have psychological factors, meaning the mindset, how one perceives reality, how one responds to reality. And of course, social factors, the stress from everyday life, stress from adverse life experiences, all these. So yeah, all these can, accumulate and combine into causing depression.
So if a person is experiencing symptoms of depression, they're aware that, there's something causing this.
Yeah.
How do they move to the next step of, diagnosis? Because, and the reason why I ask is, we live in the internet age. people go to Dr.
Yeah.
Google.
Yeah, true.
They'll say, "Oh, I'm depressed. I'm self-diagnosing." If it was a biological disease, you wouldn't do that. You wouldn't say, "Oh, I'm gonna Google if I'm diabetic. I'm gonna Google if I have some other physical
Right,
disease."
right.
But people tend to do this with mental health.
Right, right. Of course, when we talk about depression, most people equate it to sadness. And we know that sadness is a normal human emotion, right? We get sad. It's also normal that we have fluctuations in mood. Because normal mood is never flat. Normal mood is a range, right? That there are days when we're excited, extra happy, motivated, or days when we're not so driven. Okay, and that's completely normal. When we talk about depression, we're talking here about mood that goes below the floor, meaning very, very low mood. And what's important to say that it's a clinical depression is that it's prolonged in duration, meaning 2 weeks or more of really extreme sadness, or 2 years of more of what we call low-key sadness, because there's also the type of depression which we call, in layman's term, like high-functioning depression. Like they seem to be okay outwardly, but inside there's low self-esteem, low concentration, low mood, but for a prolonged period of time. And most importantly, Yuri, for us to say that it's a clinical depression, these symptoms have to be impairing one's functionality, meaning relationships with friends, with family, with loved ones, functionality at work or in their school. These things.
Okay. So if you don't mind, just so I can understand this, especially for the listeners. So one, it has to be a mood that is far below your normal sadness.
Right, right.
Is that what you're saying?
Right, right.
Okay. And there needs to be a persistence, like it's over a longer period of time.
Yes.
And then there's degrees of how you diagnose.
Right.
Right. Okay. And so how do you diagnose someone with depression?
Okay. Well, using these criteria, you do it in a comprehensive clinical interview.
Okay.
And from there, we can diagnose and say that this is a medical illness, clinical depression, which requires, just like any other medical illness, it requires treatment.
Okay, great. And what's the role that psychologists play in terms of applying like battery of assessments, things like that to strengthen the diagnosis? When do
yeah.
you call upon that?
Okay, that's very helpful. Okay, the medical part of it, the clinical diagnosis can be done in a comprehensive interview with the patient. But of course, we have tools that can help also in screening, for instance. Let's say we're talking about a large group of population and we want to catch the depression right away. Screening tools from psychologists would help. Also, the many other comprehensive tools that the psychologists have, they can help us understand the depression of the person. Each depression is unique in terms of the unique personality of the person, the unique resources, the unique, intellectual aptitude, emotional resources. So those tools are very helpful in understanding the depression and treating it accordingly, personally.
Okay, gets. Right. So the assessments take into account all the various factors of life.
Right.
Okay, so maybe let's move on to common treatment options.
Okay.
Okay. So the first one is, what would be the types of medications that you would use?
Okay. Well, before I talk about medications, because most people think, unfortunately, that you need to medicate right away, right? I'd like to talk about treatment in general.
Sure.
Because when we talk about managing depression, as I said earlier, it's caused by multiple factors, right? As you mentioned, the biological, psychological, and social. Hence, when we manage, when we treat, it has to be done holistically as well. Okay? Meaning, we make sure there are biological factors that we correct the chemical imbalance in the brain. And for that, we can use conservative options or medications. Conservative, meaning they eat well, they sleep well, they exercise, they get enough vitamin D, sunlight exposure. Well, there are cases, of course, wherein the conservative measures may not be sufficient, and hence we will need medications in those cases. That's biological. Psychological, that's where we try to help persons, learn how to cope, how to deal with stress, how to deal with adverse life situations, emotional wounds, these things. And social part of treatment is when we help them to maximize their resources, help them identify what environments, what relationships are toxic for them, and hence avoid them as much as possible or manage them if they can. So it's a comprehensive, holistic approach. In fact, in some schools of thought, they also include a fourth factor. Aside from biological, psychological, social, there's also the spiritual factor. When we talk about spiritual here, we're not referring simply to the practices of religion, but to a broader concept, meaning spiritual in the sense of, the sense of meaning, sense of purpose. Because scientific studies show that people with high sense of spirituality, high sense of meaning, are actually more mentally resilient and mentally healthy. So basically, that's the entire picture, how we manage depression.
Wow.
Yeah.
So there's a lot of factors there. And the spiritual. Yeah, that's fascinating.
Yeah.
Thank you for sharing that. Okay. Biopsychosocial, spiritual. Yeah. Social, as you mentioned, toxic relationships.
Oh,
I
yeah.
think we all know about that. It's everywhere. It's in work.
Yeah.
It's in
Family,
family
yeah.
dynamics, in friendship groups. So that there needs to be a new chart that shows that.
Yeah.
Okay. So going to therapy, what would you say are the most common therapies for the average listener?
So we talk about here talk therapies or psychotherapies. I think a good way of explaining it, we can do an exercise here, Yuri, if you don't mind.
Okay.
Yeah? Okay. Let's do a quick mental exercise. I'll ask you now to think of a purple elephant. Can you do that? Okay. A purple elephant. You can be as creative as you want. Imagine a purple elephant. Yeah? And now tell me the size of your purple elephant.
Massive.
Massive. Like how big in terms of feet?
The Hulk from the Avengers, but
Okay.
purple.
Massive indeed. Okay. And what do you see surrounding your purple elephant?
A forest?
A forest. Okay.
Yeah. A lake?
Okay. What is the expression on its face?
Pretty happy.
Happy purple elephant. Massive, happy purple elephant.
Yep.
Okay. So if you notice, Yuri, you have in your mind right now a thought of a purple elephant, right? It's a complex and vivid thought, such that it has size, the humongous size. It has a location with, as you said, lake, forest, happy face. But in reality, Yuri, is there a purple elephant as you have it in your mind now?
Not that I know.
Okay. Okay, so this mental exercise, it may seem so silly, so funny. It's reminding us something that we often forget. Unfortunately, to our detriment, okay? That the fact that something is there in the mind doesn't automatically mean it's true. Hence, if it's not true, then it can be inaccurate, false, or worse, it could be a lie. And we know it's not so wise believing a lie, more so making decisions based on them, right? Okay, why do I say this? Because when we talk about talk therapy, one of the common talk therapies that we do is cognitive behavioral therapy, wherein we help patients catch their purple elephants. And this is very important because, at least in my experience and as we see it, majority of the things that cause us sadness, depression, anxiety are purple elephants. I often hear this in my clinic, like every day people telling me, Doc, I feel that nobody understands me, nobody loves me, nobody cares for me. And me, I really think and ask the patient, nobody, as in zero? No, that, because if nobody cares for you, nobody understands you, you really have all the right in the world to get depressed, right? But the question is it true that nobody understands you, nobody loves you, or is that a purple elephant?
I see.
So this is just one example of the beauties of talk therapy. So cognitive behavioral therapy. We also have other things like mindfulness, psychodynamic psychotherapy. Many things. If I say everything, we may not have enough time for it. But we have several options that people can use depending on what they exactly need.
Amazing. I love that analogy of the purple elephant. So it's rescuing someone and pulling them back into reality.
Right.
Would you
Right.
say? And so
Right.
when they start to be more aware that, it's maybe not as bad as I had imagined,
Exactly.
and in fact, it could be normal
Oh, yeah.
across a community,
Right.
then there's a sense of relief, would you say?
Yeah. Relief, clarity, right? And then they realize, okay, I respond to what is true, okay? And responding to what is true is important and adaptive, in day-to-day reality.
Yeah, fantastic. Thank you for sharing. Are there any lifestyle changes that can help depression?
Definitely. As we go back to the model, the biological, psychological, social, and spiritual model, several lifestyle modifications can help there. As I said, eat well. I remember the story of this patient of mine. She was chronically depressed, really depressed for several years, and then on various medications, has been changing psychiatrist, but still the depression was there. And we were wondering, it was a big puzzle for us, how come this depression is so persistent? And then one day, we asked, what's in your usual diet? What do you usually eat? And only to find out that every day she eats almost every day processed food or high sugar drinks. Okay, why do I say this? Because the brain is a wonderful organ. It manufactures like a factory the chemicals that we need for good mood, like serotonin, dopamine, or epinephrine, all these things. But for that factory to work, it needs raw materials, just like any other factory, right? And food is there for that. So people have to maximize taking advantage of food to manage your mental health challenges. So that's one lifestyle modification that's possible. Another thing that I often recommend to my patients is behavioral therapy, meaning using activities to help lift your mood. I always tell them, it's very simple. Do more, feel better. And usually they tell me, Doc, what do you mean do more? Do more. We're overwhelmed. We're flooded with work. We can barely have time for self-care. But when we say do more, I say, don't just do anything, okay? Do more means do more of the things that that you identify are refueling for you. Because this will be unique for every person, right? So do more of what is relaxing, restful, creative.
Wow, those are really two, I think, doable lifestyle changes. So nutrition.
Right.
So reducing processed foods.
Oh, yeah.
Did you say sugars?
Yeah, also.
Sugars.
Yeah.
Okay. That's a lot. Who loves
But
fast food?
that's a
Whoever's
challenge, of
listening.
course.
Who loves fast food? Yeah. So, but reducing that drastically would help. Obviously, your brain
Right.
chemistry, your brain health.
Right, right.
Right. Okay. And then exercise.
Definitely.
Okay.
Yeah, definitely. You may want to share, Yuri, things that worked for you, since you said that there was a time you were also suffering from symptoms, right?
Yeah. So I mean, for me, I'm definitely far along the healing journey. I do my morning priming now, which is a combination of, waking up, breathing, like
Right.
trying to breathe properly,
Yeah, relaxation techniques.
relaxation
Yeah,
techniques,
wonderful.
which is a form of meditation,
Oh,
I
yeah.
guess.
Yeah.
I move my body, so I do some yoga to challenge the range of
Right.
motion for my body, and then I do affirmations. Right, it controls now. I guess I have this analogy that the purple elephant, the affirmations control my purple elephants
Yeah, yeah.
in life. And yeah, I'm definitely watch my nutrition. I try to stay active.
Great.
And even then, there are times where the emotions can come along, right? But that's probably very specific for myself because I have a very specific experience. But I think for most people listening, I think those basic lifestyle changes could go a really long
Can really
way.
help. Yeah, I agree.
Okay.
Okay, so we talked about talk therapy, lifestyle. We can mention a bit about medications.
Sure.
'Cause it wouldn't be a complete picture, right?
Yes, please.
Of course, when we talk about medications, this is like a challenging topic because, of course, nobody wants to take medications. Do you want to take medications, Yuri?
Ang mahal, di ba?
Mahal, no? And if possible, right? I myself, I wouldn't want to take medications. But, of course, when we need it, it's wise to take it, right? Like someone with iron deficiency anemia would need to take iron. Aside
Yes.
from iron from food, we don't say, don't take iron, that's bad, or that's addictive. No. I always tell my patients, especially those who are hesitant when it comes to medications, that the mental health journey is like driving. Okay? That we have a goal, whether that's go back to work, have good relationships, live well. So you have your goal, your personal, unique goal, and we, the mental health professionals, we accompany you going to your goal. And talk therapy is an important part of that journey. Talk therapy is like teaching you how to drive, teaching you to know the specs, the power, the capacity of your car, teaching you how to read a map, teaching you the hacks of driving. The thing is, no matter how good you drive, you will never move if that car doesn't have gas. Okay? And that's where the medications come in. Now, not everyone with depression will have a tank empty, will have an empty tank without gas, okay, which is good news. Hence, we say that not all people with depression would need medications, especially the mild ones. They can really respond well and do well with talk therapy and the other lifestyle changes. So, yeah, basically, I'm just saying here that we use the medications when we have to use them, when we need them.
Of course.
Okay.
What support systems would you say are available to people
Okay.
for those struggling with depression?
Right. Very important that people maximize their support systems. We're talking here about the social factor, right, of the biopsychosocial spiritual model. They can start with the most proximate to them, family, friends, find ways to really manage and improve and optimize those relationships. Find ways also to get resources available to them in the community, in their workplaces, in their in the cities where they live. And now we're so blessed with technology, right? You can have multiple resources. Technology can be our ally when it comes to managing depression. I'm sure you yourself, you can talk about how technology can be maximized, right?
Yeah, so I think my unlikely path into the mental health industry came from my own experience, and ever since starting an organization called Mind You, our mission is to provide mental health resources at scale for people in the general population and for companies. So to give you an example, when we service a company with 20,000 staff, they get access to a community forum where they can blank out their name, they can make their own name, but they can vent talaga nasa community forum.
Yeah.
And we have psychologists that moderate that.
Yeah.
They can book talk therapy sessions at the hit of a button. They can see which psychologists they resonate with, what they specialize in, guided journaling, mood tracking, educational self-help resources, how to breathe, how to exercise. And so, yeah, we're developing that. We're still young, 4 years pa kami. So our goal is to incorporate doctors like yourself so that you can educate more people, and then there's a lot of mental health professionals, actually, layers of them.
Yeah.
You got your psychiatrists, your psychologists, registered guidance counselors,
Right.
social workers. And then if you add your behavioral health practitioners and medical professionals in there,
Yeah,
it needs to be accessible to people.
I agree.
Yeah.
I agree.
At a low cost.
Agree.
And that's where I agree with you. Technology can be our ally,
Right.
right? If it can provide resources to more people, then that's something we have to continue working on as a country, I would say.
Yeah.
And Medical City is a fantastic, leader in that area, and so that's why we work closely with TMC actually on that fact. So, thank you. I think those are really great shares that you've provided. I think this brings us to an interesting part of the podcast:
Okay, let's go.
medical mythbusters, fact or fiction.
Okay.
Okay, so first one, fact or fiction.
Okay.
Depression is just sadness.
Okay.
Myth.
Myth.
Okay, it's a myth. Okay, why?
Well, as we mentioned earlier, sadness is a normal human emotion, but we know depression is different. Depression is an illness and it requires prolonged periods of depressed mood, intensity that impairs one's functioning.
Next one. You can just snap out of depression.
I wish it was that easy, Yuri. Okay. Yeah, definitely. We cannot just snap out of depression. No?
Yeah.
I need not explain this.
Why do you think people think that, right? As a myth, you can just snap out of depression.
Yeah, or they say it's just in the head. Definitely, it's in the head because it's a brain disorder. But if it were that easy, we wouldn't have the 700,000 suicides, every year. You cannot just snap out of it. because it's a medical illness, just like any other medical illness. Like if you have asthma, you don't tell someone who's having an asthma attack to, you can do it, just snap out of it. A medical illness requires medical management. Yeah.
Absolutely, I totally agree. Okay. Next one. This is an interesting one. Fact or
Okay.
fiction? Depression is a sign of personal weakness.
Okay, definitely. And it's unfair, for people who are depressed to be told that you're depressed just because you're weak, you lack grit, you're being a snowflake. In fact, that puts them at deeper levels of depression. Okay, and this is also the reason why many are still hesitant about coming out, and the stigma is still very high
Yun na nga.
because nobody wants to be judged as weak, right?
Yeah. Yun na nga, that's the stigma, no? Especially coming from managers, leaders,
Yeah.
influencers, right? It's not a personal weakness talaga.
Yeah.
I would even go as far as saying that, being vulnerable and being honest
Oh yeah.
and courageous about facing, mental health
Yeah.
challenges is in fact a attribute.
It's a sign of strength.
Yes, it's a
not
sign of
a
strength.
weakness at all. Yeah.
Thank you. I appreciate that. Okay. Next one. Fact or fiction? Antidepressants are the only way to treat depression.
Okay, and that's good news, right? That we have various armaments that we can use. We can use, as we said, lifestyle modification, psychotherapy, talk therapy is wonderful. Please maximize that. Support systems, spirituality, medications only when needed. Okay, and definitely, yeah, there will be cases when they're not yet needed because they're too mild, or because the other options can work well.
Last one. Fact or fiction? Depression only occurs during a traumatic event.
Okay. Myth to the only. Okay. Definitely, traumatic events have a role to play.
Yes.
People with traumatic experiences are at great risk for getting depression. Not just trauma, but other adverse life experiences. Imagine if you get one day diagnosed with cancer, for instance. Of course, that can be very depressing, right? Or if you lose a loved one, experience of abuse, neglect, all these things, they put you at high risk. Precisely, that's where we see the importance of mental health and looking for resources, so that even before they go into a clinical depression or a pathological state, we can help these people, those with trauma, adverse life events. We can help them in adjusting and in coping.
I love what you said when you mentioned at high risk.
Yeah.
Yeah, so they're at high risk, and I think that's the time where we need to
try to catch
intervene,
them. Yeah.
catch them,
Yeah.
and also approach the preventative aspect,
Right,
being able
right.
to re-socialize, re-normalize them.
Right. I like how you mentioned the preventive aspect, because when we talk about mental health, we're talking here about a continuum.
Yes.
Okay? Not just mental health when they're ill. No, continuum meaning we need mental health, we need mental wellness even when we're well, to make sure that we keep that mental wellness and we avoid and prevent problems, right? We need that mental health when we're at risk. Every day we have stressful situations, things that exhaust our coping mechanisms, exhaust our stress management techniques. So here we need accompaniment as well. And of course, the last part of the continuum, which is illness itself.
Yeah, that's very valuable. In fact, I'd love to get a visual of that. Maybe we can share it somewhere online sometime.
Right.
Yeah, that'd be fantastic. Thank you very much, Dr. Daphne.
You're
Dr.
welcome.
Daphne Ong,
You're welcome,
everyone, for sharing your expertise with us today, shedding the light on depression and the misconceptions. It's been hugely helpful.
I hope
I
so.
myself, as just the host, I love picking the brain of someone that's qualified in the mental health profession, in the industry, helping people. Very grateful for this time, and I
Right.
hope everyone that's listening has gotten some benefit from it. Is there any last words or any last tips you want to give to people before we wrap up?
Nobody deserves to live with depression. And there are ways. No, we have told you several means to prevent depression and to treat the clinical illness of depression. So please make use of those means. Please get help, and please help others to get help. The means are very effective. They're safe. They can help you regain the spring in your footsteps and the sparkle in your eyes. They can help you regain the drive to want to live, hope, love. So please, and we're here, your mental health advocates, your mental health professionals, to help you in that journey and to accompany you. That's it for today. Thank you for joining us, and we invite you to join us again next time here at TMC Talks.